Hi, my name is Elizabeth Moore, and I'm a nursing student at Indiana State University, and this is my presentation on ADHD identification and best practices for diagnosis and treatment. Population at risk. ADHD can affect anybody, but certain things put you more at risk, including gender. Boys are more frequently diagnosed with ADHD than girls, although research suggests that ADHD affects a greater number of girls than typically and traditionally reported. ADHD may be missed in girls because of the way their symptoms tend to manifest compared to boys. Genetics. ADHD and similar disorders tend to run in families, suggesting there may be a genetic component. Age. Symptoms typically appear in young children aged 3 to 6 years old. Maternal factors such as smoking during pregnancy, preterm labor, mental health conditions, and exposure to certain environmental toxins. Most cases are diagnosed when children are between the ages of 6 and 12 years old. Objectives. After this presentation, you should be able to define ADHD, describe common characteristics of children with ADHD, identify complications associated with ADHD, identify the 3 main treatments for ADHD, and recognize the conditions that most commonly coexist with ADHD. Please pause now and take the attached pretest. What is ADHD? ADHD is one of the most common neurodevelopmental disorders affecting children. It is usually first diagnosed in childhood and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulse behaviors, or be overly active. An estimated 8.4% of children and 2.5% of adults have ADHD. ADHD is often first identified in school-aged children when it leads to disruption in the classroom or problems with schoolwork. Despite how common ADHD is, doctors and researchers still are not sure what causes the condition, although it is believed to have a genetic or neurobiological cause. How ADHD affects the brain. Research suggests that a reduction in dopamine is a factor in ADHD. Dopamine is a chemical in the brain that helps move signals from one nerve to another. It plays a role in triggering emotional responses and movements. Certain parts of the brain may be less active or smaller in children with ADHD than those without the disorder. Other research also suggests a structural difference in the brain. Findings indicate that people with ADHD have less gray matter volume, which may affect their speech, self-control, decision-making, and muscle control. Some research has also indicated that there's a difference in pathways within the brain between ADHD and non-ADHD children. Smaller frontal lobe. The frontal lobe is the part of the brain that controls executive functions. Executive functions involve active, conscious thinking like memory, problem-solving, language, decision-making, and planning. It is also responsible for some of the passive skills like motivation, judgment, and time perception. Types of ADHD. Inattentive. As the name suggests, people with this type of ADHD have extreme difficulty focusing, finishing tasks, and following instructions. Experts also think that many children with the inattentive type of ADHD may not receive a proper diagnosis because they do not tend to disrupt the classroom. This type is most common among girls with ADHD. Hyperactive impulsive type. People with this type of ADHD show primarily hyperactive and impulsive behavior. This can include fidgeting, interrupting people while they're talking, and not being able to wait their turn. Although inattention is less of a concern with this type of ADHD, people with predominantly hyperactive impulsive ADHD may still find it difficult to focus on tasks. Combined. This is the most common type of ADHD. People with this combined type of ADHD display both inattentive and hyperactive symptoms. These include the inability to pay attention, a tendency towards impulsiveness, and above normal levels of activity and energy. The type of ADHD you or your child has will determine how it's treated. The type you have can change over time, so your treatment may change too. Signs and symptoms of ADHD. For inattentiveness, they include short attention span, easily distracted, making careless mistakes, especially in homework, forgetful or losing things, unable to stick to tasks that are tedious or time-consuming, unable to listen to or carry out instructions, constantly changing an activity or a task, having difficulty organizing tasks. For hyperactivity and impulsiveness, they include being unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, being unable to concentrate on tasks, excessive physical movement, excessive talking, being unable to wait their turn, acting without thinking, interrupting conversations, and little or no sense of danger. Diagnosis. In general, a child should not receive a diagnosis of attention deficit hyperactivity disorder unless the core symptoms of ADHD start early in life, before the age of 12, and create significant problems at home and at school on an ongoing basis. There's no specific test for ADHD, but making a diagnosis will likely include a medical exam to help rule out other possible causes of symptoms, a complete health history, such as any current medical issues, personal and family medical history, and school records, interviews or questionnaires for family members, your child's teachers, or other people who know your child well, such as caregivers, babysitters, and coaches, the ADHD criteria from the Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association. The diagnostic criteria for both inattentive and hyperactive types of ADHD include 6 or more of the symptoms to occur frequently, and the symptoms have been present for at least 6 months and are inappropriate for developmental level. And ADHD rating scales to help collect and evaluate information about your child. Complications and coexisting conditions. Although not always the case, some children may also have signs of other problems or conditions alongside ADHD, such as anxiety disorder, which causes your child to worry and be nervous much of the time. It may also cause physical symptoms, such as rapid heartbeat, sweating, and dizziness. Oppositional defiant disorder, or ODD. This is defined by negative and disruptive behavior, particularly towards authority figures, such as parents and teachers. Conduct disorder. This often involves a tendency towards highly antisocial behavior, such as stealing, fighting, vandalism, and harming people or animals. Depression. Sleep problems, finding it difficult to sleep at night and having irregular sleep patterns. Autistic spectrum disorder. This affects social interaction, communication, interests, and behavior. Epilepsy, a condition that affects the brain and causes repeated fits or seizures. Tourette's syndrome, a condition of the nervous system characterized by a combination of involuntary noises and movements, and learning disabilities such as dyslexia. Treatments for ADHD include occupational therapy. The goals of occupational therapy are to improve attention, behavior, gross motor skills, anxiety, and sequencing. Behavioral therapy. The goals of behavioral therapy are to learn or strengthen positive behaviors and eliminate unwanted or problem behaviors. Behavioral therapy for ADHD can include social skills training. This can help children learn appropriate social behaviors. Parenting skills training. This can help parents develop ways to understand and guide their child's behavior. Psychotherapy. This allows older children with ADHD to talk about issues that bother them, explore negative behavior patterns, and learn ways to deal with their symptoms. Family therapy. Family therapy can help parents and siblings deal with the stress of living with someone who has ADHD. Medications include stimulants and non-stimulants. Medications can affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to one medication but not to another. Talk with a doctor if you see any of these or other side effects while taking medications. Managing symptoms for ADHD include creating a routine, getting organized, managing distractions, limiting choices, be clear and specific when you talk with your child, help your child plan, use goals and praise or other rewards, discipline effectively, create positive opportunities, provide a healthy lifestyle. References. Thank you. Please see the attached post-test and brochure that accompanies this video.